we've seen a Cheshire school hit crisis point, with more than 200 staff and pupils off sick at the same time at Congleton High School. The head teacher was forced to shut yesterday and today for a deep clean. This is what people in the town told BBC Radio Stoke's Ethan Saunders.
I'm a big believer in trying to make sure that you can get on top of things like the viruses for the children and keep things clean. I think it's absolutely the right decision, and I think the headmistress has really got balls to do it, so well done. Yeah. I think it's a really good decision, yeah.
Have you, or do you know anyone who's got children in the school?
Yes, my nephew's there, so he's of an age where he's okay. I think he's with his grandparents today, his other grandparents on the other side, and you know, we're in a day and age now where most of the learning can be done online. You don't physically need to be there, surely. I think rather than, you know, people being concerned about not being able to get the children into school, look at ways to do the remote learning and let them do a deep clean, let them do a reset, and then it's probably the best, you know, in for the sense of the whole community, surely.
I don't think they should close it just for that. I think they should, you know, stand up and be counted. You know, everybody else is going to school or going to work, so you know, why should they be any different?
The amount of children that have always got coughs and colds at this time of year anyway, half the school is full of coughs and colds. So for me, it's a massive community thing. The kids are all full of colds, so if you're going to protect the wider community, fantastic. Get the kids off school, get the teachers off school, get those that aren't well back home, get them safe, get them obviously looked after. It's coming up to Christmas and no one wants to be ill over Christmas.
So that's what people in Congleton think about the town's high school shutting for 2 days this week for a deep clean because 200 of its students have been off with flu at the same time. It did so after getting advice from government health experts. The school says it'll email and message parents this afternoon ahead of reopening tomorrow. Dr. Matthew Atkinson is a consultant in public health at Cheshire East Council. Matthew, good morning.
Good morning, Lee. Thanks for having me.
No problem. First and foremost, how worrying is this? 200 off in one go with the same thing?
Well, I won't comment on the exact number of people who they've had off. I'll leave that to the school to comment. But obviously, it is concerning at this time of year. We do see more colds, flus, coughs, and other respiratory infections at this time of year. And it is a time of year where schools are more likely to have more people off with those type of infections. So we just need to make sure that we're putting everything in place to protect the people who are in the school, but also the wider community. Obviously, the best way that you can do that is by washing your hands regularly, staying home from school or work when you're unwell with a flu-like illness, and also, most importantly, probably is getting vaccinated if you're eligible to do so.
How bad is the flu situation in the area for people who are worried about this? Because you'll have people who hear this story and will be genuinely concerned, and at the same time you'll have people who are maybe a little bit more cynical going, have they all got flu, or was it just a few people with a cough?
Well, as I say, those type of infections are really common at this time of year, and it's often quite difficult to tell the difference between the different infections that are circulating. With regards to flu, as your previous segment said, about a month ago, we were really concerned that we were heading for a very bad flu season this year. It's not quite hit the heights that we were worried about yet, but now we've had this cold snap in the weather. People will be mixing more and then coming together at Christmas. There's still time for that picture to worsen. So we are seeing cases increase. We are seeing more people go to their doctors with flu. We are seeing more people attending hospitals. And what we need to do now is put everything in place to try and limit how high that rate gets over the course of this year.
What do you make of the measure that was taken to shut the whole school? A sensible approach so that it could have a thorough deep clean, a little bit extreme? What do you make of the head teacher's decision there after she sought advice?
Well, I can understand people's concerns on both sides. Obviously, we need to protect the students and staff, and we need to protect the wider community. The school needs to be able to undertake those deep cleaning measures. And there are lots of reasons why a school may choose to close. That could be on public health advice. That could be because of the measures they've got to take in terms of cleaning. That could be because of certain members of staff being off that are critical for running the school. So there are lots of different reasons that a school might need to close. But what we've learned in COVID is that we do really need to balance that against what we know is the risks to children of missing time in education. So it won't have been an easy decision to take. But we're fully supportive of what the school is doing and working with them to get those cleaning measures in place and get the students back in safely.
You touched on it a few moments ago, just on vaccinations and jabs. Just how much would you encourage people of whatever age to get one of these if they can? Because it was something that was obviously massive during COVID. Some people for it, some people very sceptical and were against it. But with the flu jab here specifically, how much are you encouraging this as a health body?
It's probably the most important thing that we can do to protect ourselves against flu at the moment. Obviously, washing your hands, practicing good cough hygiene, sneezing into a tissue and throwing it away is important, and staying away from school or work if you've got that flu-like illness until you're well and your temperatures come down without medication is really important as well. But getting your vaccination is critical. And people who are in school at the moment will be getting visits from their local service to deliver those vaccinations. And we'd encourage parents to support those children to get those vaccinations. But people outside of those age groups can get them as well. So parents of children who are 2 or 3 can go to their GP to get their vaccinations. And then there will be people who are pregnant, who have got certain long-term conditions, who are over 65 or who are carers, for example, who are all eligible for their flu jabs this year. So we'd encourage you to go and speak to your GP, speak to your pharmacist, understand what you need to understand about the vaccine, and then get it done this year and get it done in time for Christmas, because those people will be coming together and mixing. And the more indoor mixing we get, the more likely the flu is to spread. Well,
I was going to say, just finally, the other big bit of advice here is if you do think you've got it, try and limit social contact as much as possible. Don't do what the man with a horrendous cough at Anfield did last night, sit behind me and turn up and cough non-stop for 90 minutes. Isolate as much as possible and stay away from people, right?
Yes, I mean, it's bad enough going to Anfield as it is without having someone coughing next to you, but... yeah, I would certainly recommend that people who are ill stay away from other people, especially vulnerable people, as much as they can. And that means staying off from school. And that is until you're well and until your temperatures come down. And that's without paracetamol. It's no good giving your children paracetamol and then them going in, because that just masks it. It doesn't stop them being infectious to other people. So it's really important that we protect schools and staff by keeping people off when they're not well.
Thank you for talking to us. Thank you for giving us the insight into Congleton and giving us all that advice as well. I've got to ask, just before I let you go, with a comment like that, was that Liverpool dig coming from an Everton or Manchester United point of view?
It's a Manchester United view, but that is a personal view, not that of my organisation.
Well said, mate. Well said. Thank you so much, Matthew.
Thanks so much.
Top stuff. That is Dr. Matthew Atkinson speaking to us there. He's consultant in public health at Cheshire East Council on This Morning, following that news which broke this week. Congleton High School forced to close for 2 days because more than 200 of its pupils have been off with the flu. So he was talking to us about the situation there at the school, the steps that the head teacher took, and advice for the wider public if they're A, concerned they have got it, or are B, concerned about getting it. Your thoughts on what you've just heard, welcome there. 08000 321 333 with Stoke at the start of your message.